Matthew Holt. IPOs are going up. IPOs are going down. We have IPOs that are meh. And the moment I know our audience has been waiting for, a certain DTX company is SPAC-ing out. What do you think about that over there, eating your apple?
Well, I like apples. Not convinced about pears.
Oh my God. It's the June 25th episode of Health in 2.0. Every time we try to set you up for a joke, there's a moment where I'm like, is he going to land it? Is he going to land this joke or not? I genuinely worry.
I wouldn't be that worried. I mean, people used to be not being funny by this stage.
Oh, okay.
All right. Tell us about these IPOs.
Oh my God.
2 today, 1 yesterday.
Oh my God. So Bright Health down from what they expected was going to be. They thought 13 down to 11.
Yeah, they actually moved their range down from 20s to like 18. It's still losing a ton of money. Revenue's about 1.2 billion, but still $11 billion valuation for a health plan with about 1.2 billion in revenue. I mean, if you valued Humana or United Health Group on that scale, they would be bigger than Apple. But we'll see how they. It was an interesting one because in their IPO they were mixing this whole idea about doing like a technology company to run medical groups, and it's a bit confused. But everyone's fine. That's the same place, by the way, that Agilon's gone and that outside alignment's gone, and Agilon's kind of going, and also Babylon's going, and Kano, which bought somebody last week.
Yeah.
So they're all kind of piling into that medical group management technology phase, and Oscar and Clover are kind of milling around in that space as well. So interesting, and that probably is the biggest IPO that we've covered in our space. I don't know if you call it exactly digital health, the health plan, but huge. But not the digital health IPO that's the big one up today, which is our buddies, Jeff.
At Doximity.
Sorry. I can never say his name right. Jeff Tangney. Thank you, Jeff. Jeff will get upset that I don't know how to get his name right. Nagos and the crowd at Doximity. We're doing very well. Rang the bell today.
Yep. 7.3 billion, I think, is what they came out at.
It was
expected to be at 4.6.
They priced it at 4.6, and it's trading at up 60%, or 7.3 billion change, which is a big deal, right? They could. They're also a telehealth company. They could buy American Well at this price. We'll see. And then there's one more, right? Yesterday, SPAC out.
Talkspace. Finally, we were wondering when that was going to go. It's been a long time, and they've managed to do it and come out in like a zen, even place. Like, this is like one of those accountability things, I think, in therapy, where it's like you do what you say you're going to do and honor your commitments. They said 1.4, they're trading at 1.3. All right.
It's doing all right. I mean, there's a lot in that mental health space. We'll have to see what happens when Lyra and Ginger and those other folks who raised a lot more money start thinking about going out. Talkspace are the ones who had Michael Spence. God, I can't talk.
Michael Phelps. What is wrong with you?
Many things, but clearly the ability to speak is lost today. Well, we better quickly get into the 2 minutes.
Oh, will it? Here.
Well, we're still ready.
Sponsor subtitles, please. It's hilarious because the talking. Okay. And Bicycle Health. Let's start there. They raised a $27 million Series A that brings their total up to 32.3. This is a substance use disorder startup.
Yeah, it does substance use telehealth. There's a whole bunch of people doing this. I have no idea why they're different than anybody else, but good luck to them. We certainly have a very big need for sure. Medication-assisted therapy, which is Suboxone and other drugs, are helping people with opioid use disorder, and good luck to them.
All right, NexHealth, which bills itself as a Shopify for doctors. They raised a 31 million Series B. This brings their total up to 46 million. What do you think about this?
So clear about these guys. They seem to be doing more work with dentists, helping them with scheduling and marketing to patients. And then they're going to move it over. That's a big raise. The valuation apparently was over 400 million. So for a company I don't know too much about, they're doing well.
All right, what about Stork Club? This is another fertility play, 30 million in an A. Their total up to 32.7. So this is big money for them.
Yeah, I'm just staggered about how many people there are doing fertility deals, but the answer is a lot. So, yeah.
All right, what about DrChrono? They get 12 million, brings their total up to 60 million. They're a tiny little EMR company, right?
Well, I mean, they've been around a long time. They actually launched a Health 2.0 in 2010. So they've been doing a lot of years. They've been building slowly. My chiropractor uses them as his EMR. So they've got some stuff going. They've been doing more and more integration with telehealth and stuff and with the Apple Health. But they're basically an EHR and a PM vendor for small practices. There's lovely software. I don't know how fast they're actually growing.
And if you sat through this whole 2 minutes, you've been waiting to hear what the big guys got to say about Pear Therapeutics, the digital therapeutics company that has announced that it is SPAC-ing out. The valuation, $1.6 billion, expecting to raise $284 million with this. Matthew Holt, tell us, friends, settle in, what you think about this one.
Well, here's the issue, right? So the deal is, and we talked about this many times before, they believe they
not going to stop you.
They believe, and they can take a process that somebody else has done. By the way, this is all importation of other people's, web-based processes. Build an app that does it. They're starting off with insomnia, like the folks at Big Health with Sleepio, but they've got an insomnia one. They've got an opiate use disorder one. I think they've got a schizophrenia one, and they've got another 100 allegedly in the pipeline, right? And the goal is that you can patent this independent digital therapeutic, have it prescribed by doctors, so make it just like a drug, get it, through the FDA, and then sell it, and sell it to insurers and Medicare and others at a pretty decent clip. At what's more than probably the generic, it's been the generic actual drug that's being used for those conditions. So whether it takes off or not is a big bet. I mean, they have almost no revenue. They have like 4 million revenue this year. They've been going for a while. They've had almost no revenue. They've raised, I think it was about 285 million over their time here, and they're planning to raise a whole chunk more. I think it's another 300. I need to check it, but I think another 300 million plus in the SPAC. So and then they say in their deck that in 2 years' time their revenue will be 125 million. So you're taking a hell of a bet that all these things, that the pricing can hold up, the doctors will prescribe the thing, patients will use it, and that payers will pay, and pay at kind of the price that they're trying to set it at rather than the much cheaper price the software ought to be at rather than massively expensive, and that this works better than all of the other types of tools and competitors who are just, doing it in conjunction with health plans or in conjunction with employers and are not going down that DTX route and making basically available to consumers at a cheaper price. You can tell I'm not a fan, but
it just seems so speculative. Like much more so than a lot of these other new businesses that we have seen.
Well, I mean, basically what they're doing is saying that we're going to be like a biotech company, right? Go public to raise money, have no revenues for a couple of years, but figure out that if we get these things, quote unquote, through the FDA, that we'll be able to sell them. The issue is it's very clear that plans and Medicare will pay for expensive biotech drugs. It's not clear that anybody will pay an increased fee for this type of prescription therapeutic compared to other stuff that they're currently paying for or doing now. And that may or may not change. They made a bet, and good luck to them. I'm not completely thrilled the way they're doing it, because I don't think that's how software and digital tools for health should scale, but that's the way they've gone.
For more about this man's passion for technology in healthcare that doesn't increase price, you can follow him over there on Twitter at BoltyBoy. I'm over at Jess Tomasa, supporting him by retweeting in this case in particular. And to make sure that you never miss an episode of these Health in 2.0 shows, so that you can stay up to date with all the latest funding in digital health and health tech, as we feel like we're at the top of this right now. We've discussed it. Pear SPAC-ing out, we feel might be at the top of the wave. But go to thehealthcareblog.com, subscribe to our email newsletter there. And you'll get all the great content from the blog, curated and delivered directly into your inbox on the weekends. All right. Well, we'll see you guys soon. Thanks so much for checking in with us. Bye.